Hello everyone, this is me Rakhi Vyas from Jadhavar Group of Institute. As we know that our President Sir respected Dr. Sudhakar Rao Jadhavar Sir and our Vice President Advocate Shargul Sir. They always insist to give a new topic and informative topic for our viewers. So let's start with the new topic that is about how to maintain oral hygiene. आज हमारे साथ में जुड़े हैं डॉक्टर श्रुति पाटिल। वो हमें बताने वाले हैं कि कैसे मेंटेन करना है ओरल हाइजीन। नमस्ते श्रुति जी, मैं आपका स्वागत करती हूँ जाधवर ग्रुप ऑफ इंस्टीट्यूट की ओर से।
गुड इवनिंग, नमस्ते राखी मैम।
तो मैम आज हम जानना चाहते हैं कि ओरल हाइजीन किस तरह से मेंटेन किया जाए।
ओके, फर्स्ट ऑफ ऑल थैंक यू राखी मैम फॉर इनवाइटिंग मी, as well as thank you so much Jadhavar Institute for inviting me to share my knowledge regarding oral hygiene. We will just start with the topic now. Today basically I'll be talking about three things, that is the basics of oral hygiene, some important dental problems which usually patients come up to us, and finally the brushing and flossing techniques which many of you would be helpful. Let's begin. Now, whenever you talk about oral hygiene, first thing what comes to your mind might be the toothbrush or the toothpaste and whatnot products which are there in the market. But then what is more important for oral hygiene? Let's talk about that first. Most important thing is to identify any problem which is there in your mouth. Sometimes we just neglect the problems and focus on all the various brands or the market products. We run behind them using the most expensive ones also, but we forget to treat the basic problem which is there in the mouth. So first you have to identify any such problem. Now such problems can be either painful or not. Sometimes they are not painful at the start, but then if they get neglected for many a times, then they start paining. Okay, so because 90% of our patients also, they turn up only when there is pain. So if any problem is treated at the root cause or when it is not painful, it can save yourself from pain and also from money. Yeah. Now for that, I would like to first tell you how to identify. Now this is a cone shape. The shape of a decayed cavity or the decayed tooth from inside, the black portion, whichever you see in the mouth, is actually in the shape of this cone. The apex portion, which is the tiniest part or the smallest part, it is visible in the oral cavity, while the base of the cavity or the decayed portion, it is inside the tooth. This portion is not visible. What is visible is only this apex, and since it is very small in size, mostly it is neglected. And yeah, and initially it might not be that painful also. But then this is the actually the inside shape of a cavity. So once a dentist starts drilling this portion, what he encounters is the bigger portion inside. So you have to just look out for such spots in your mouth. Now the second most important thing is to set up a routine. As I told you earlier, running behind expensive products is not, which is going to help you, but setting up a proper routine for yourself or for your family is rather more important. Okay, so now traditionally what we have been following is a routine when we do brush. Okay, we brush our teeth after once we get up in the morning. But now, as it is recommended, actually you have to brush twice a day. That is, before going to bed also you have to brush, as well as in the morning. Now see, once you have started developing the habit of brushing yourself at night, there is no hurry as such to brush it again in the morning once you get up. There is no hurry. Okay, because already you have brushed your teeth and off to bed. Okay, so what you can do is just go ahead and gargle with a warm saline water once you get up in the morning. Okay, that can finish up your morning oral hygiene routine, because at night, mostly after brushing teeth, we don't eat anything or drink anything. Okay, so there is no need to brush immediately after getting up. Later on, what you can do, just go ahead with your breakfast routine, your beverages, your breakfast, eating, everything. Once you have done with all that, you can brush your teeth. Now, how this is going to help you is, from that point till your lunch at least, you will have a clean teeth, your cleaner breath, and your cleaner smiles also. Okay, understood? Yeah. So a slight change in this routine might help you, because this is what we have been following since many years and also recommending it to our patients. Okay. So it will also instill this habit of brushing at night, because many a times it is either neglected or it is not followed in the families traditionally, brushing at night. Okay. But then this is a need of the hour. You have to maintain oral hygiene at the same level as you maintain your health. Okay. Third important thing is rinsing the mouth every time after eating. Now, this is again a neglected part, because many times we are busy, sometimes we are lazy doing it. But then it is very important to form and develop this habit of rinsing every time, because whatever food will stay back in your mouth, that is going to be the culprit, actual culprit, not what you eat. Even if you eat a high sugar content food, if it is not stuck up in your mouth, it is not going to harm your teeth. So the food that stays back on your teeth, it is going to do the harm. Now, what happens is, usually the food which stays back, it has carbohydrates. Okay. So the process of digestion,
मीन्स
it just
दैट
starts.
इज वन थिंग इज क्लियर कि बच्चों के लिए एक बहुत अच्छी चीज है, आप मीठा खा सकते हो, आप चॉकलेट खा
Yes,
सकते हो, उससे आपके
yes,
दांत नहीं
yes,
खराब होते, बट उसके बाद में यदि आप ब्रश नहीं करते हो, आप क्लीन नहीं करते हो, देन
yes.
इट्स गोइंग टू बी डिफिकल्ट फॉर देम.
Yes, 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 definitely, definitely. So you can go ahead literally. So once these food particles, they come in contact with the oral bacteria, what these bacteria do is they just start disintegrating this food or digesting this food, and various kinds of amino acids are formed. And now this acid which is formed in the mouth, it gets piled up, and slowly it starts disintegrating the tooth surfaces. And here begins the cavity formation. So the food which stays back is more harmful. So you have to develop and form this habit of rinsing every time after eating. Fourth and most important thing in lined up is tongue cleaning. Now see, many a times we use a tongue scraper, or sometimes the back surface of the toothbrushes also provides that rough, ridges, which easily can be used for tongue cleaning. But then many patients still don't follow this routine. So, and there are many countless bacteria developing on the rough surface of your tongue, because your tongue is not smooth, it is very rough. There is lot of bacterial colony getting developed each and every day. So, and such kind of coating which develops on your tongue, it is a major source of bad breath also. The halitosis or bad breath, what we encounter, or some patients have the problem. It is because of this bacteria which is not getting clean each and every day. So tongue cleaning with the help of tongue scraper is another aid which you have to include in your daily life. First is the toothbrush. Second will be this tongue cleaner. You have to use it. Okay. Now we'll come to toothbrushing properly. First of all, it is recommended twice a day, which I told you earlier. Now there are, it comes which type of toothbrush you should use. Now basically there are 3 to 4 types of toothbrush depending on the bristle consistency. They are the soft, medium, ultra soft, and hard. Keeping the ultra soft aside, that is not to be used in the regular basis. The soft one is also not recommended. Now see, on the televisions and newspapers and everywhere, these soft bristle brushes are, advertised on a high basis nowadays. And every patient, every other patient is coming and telling us that he is using a soft bristle toothbrush for no reasons. Yes, because they feel that it is going to protect my teeth from wearing off. but then at the same time, it is not cleaning up your gums. Your gums are more important than your teeth sometimes because they are your support system. Once you start using this soft bristle toothbrush, the plaque or calculus or any food material which is left behind in the teeth or in the overnight, what happens? It gets pushed into the gums because of the soft bristle toothbrush. It is not going to take it off. It is going to push it more in the gums. So using a soft brush is only recommended for kids. Why? Now in kids, what happens is there is lot of fall, repair, as well as rise of teeth, which is happening inside their mouth. They are going through so many changes. Sometimes they have cranky also. So for them, soft bristle toothbrush is recommended. That is only till to 1 to 12 years of age, and in patients who have high hypersensitivity problem, only then you have to go for this soft bristle toothbrush. Second will be the medium consistency one. Medium consistency is recommended for people about 12 years of age till 45 to 50 years, till they don't encounter such hypersensitivity problems. Hard toothbrush is recommended only in certain cases where there is too much of plaque accumulation, and with a medium brush also it is not going to help. Okay, only in that cases a harder brush is recommended. Otherwise, what happens is patients have applied so much pressure with their brush, in order to clean their teeth. What is actually happening is the enamel layer of the tooth, which is a whiter portion, which is there when you're young, and then slowly it goes on wearing off. What happens is manually we wear it off by hard brushing or applying too much pressure on your teeth. So applying pressure will not give you whiter teeth. You have to apply a very gentle pressure, and the timings recommended are just 2 to 3 minutes per session, not more than that. There are people who brush for 10 minutes and 15 minutes, sometimes even in half an hour. We have encountered such patients also. But then it is not going to give you whiter teeth, it is going to give you more yellower teeth. Now, why more yellower teeth? Because enamel is the outer surface of your tooth. Inside enamel is the yellow dentine surface or the dentine part of the tooth, which is yellow in color. Now, if you remove that white layer slowly, gradually the yellow is going to reflect from inside, and it is going to increase your worries. Okay, yeah. At the same time, only brushing from the outer surfaces is not, recommended. Each and every surface of the tooth has to be covered in the session. Each and every session, each surface, that is from inside. At the end of the session, I will show you the brushing technique also. Okay. The next important thing, which is actually seen in India, in some populations, they are highly educated populations, they are using flossing, but not the general population. And it is not advertised in the but it is very, very important to floss your teeth. Now, see what happens is 90% of the caries, 90% of the decayed portion of the teeth, mostly when we now, as we have experienced, it starts from between the teeth, not from the surface or the above surface of the tooth. They are between the teeth. When food starts getting accumulated, stuck up over there, that portion of the tooth, it is very crucial. Now that are the contact points of the tooth where two teeth meet each other. So this portion is not getting cleaned with your regular toothbrushing. The bristles, how much ever it is advertised, they don't go inside these gaps. So for these gaps, you need to floss your teeth. Now floss is a simple cord. It's a thread made up of nylon. You have to use it in this area so that this area remains clean, and which is the major culprit of the decayed teeth. Okay. Now this was all about the basics of oral hygiene in adults. Now let us talk about the oral hygiene in children also, which is very, very important, because there are some good habits you need to teach them in the younger ages. If you teach them then they are going to continue throughout life. Otherwise, then it is very difficult to, develop later on. Like in adults, children's teeth also have to be brushed twice a day. Now, brushing schedules can be started after you see the first tooth in a child at the age of 1 year, or sometimes 10 months or something. Teeth start appearing in children. Once you see the first tooth appearing, you have to start this schedule. It's not like complete set aane denge and iske baad we will introduce the brush. That till that time it will be too late for them. And then this thing will get instilled in that small child also, that every time after eating I have to do some routine in my mouth. That gets instilled in that child also. In very small children who have just one or two teeth, you can clean them with a washcloth, tied around your fingers, and you can just clean their gum line and the teeth with a washcloth. But after 1.5 years, you can use a small baby brush, and you can take a very small smear of fluoridated toothpaste also. And after 2 years of age, you can go ahead with a green pea size toothpaste, okay, with a baby brush. Yeah. But then, even after taking so much care, sometimes because of bad eating habits, or sometimes, even the parents are busy, sometimes they get neglected, or they are into some big thing. There is often, cavities are seen in such children also, who maintain good oral hygiene. One or two cavities might be seen in such children also. So these cavities have to be treated immediately. Now, what happens? Sometimes it is really very neglected, and it remains untreated. Now, one of the major causes, what we have experienced, we have seen so many patients, educated patients also, but then once it comes to the milk teeth, they have those facts in their mind, those myths in their mind, which they consider them as facts. And there are so many people around them, who have already told them that ye to doodh ke daat hai, they are going to fall, don't worry about them. All these facts we have been listening since so many years, and we are trying to convince our patients that yes, you all are correct. To a certain point, you all are correct, because this is a milk teeth, this set is going to be replaced with a permanent one. But then what is the main thing you need to understand is, milk teeth, they are going to fall, new permanent teeth, they are going to erupt, but according to their own biological timings. They are not going to erupt the next day once your milk teeth is damaged or decayed. You need to understand that. Sometimes this span can be as long as 5 to 6 years. For example, if a big tooth in a 5-year-old is damaged or decayed, if parents come to us, we would suggest to repair that tooth by our treatment, because the tooth which is going to replace it will come after 5 to 6 years. So how that child is going to stay for so long? How it will be, how he'll eat each and every day, each and every morsel is going to go and stuck up over there. Sometimes they come with big swellings. So such kind of attitude towards milk teeth is wrong. It's a myth that, they're going to fall and everything is fine, but then they're not going to, the permanent tooth, they're not going to take place, erupt according to your convenience, but according to their biological timings. They have all fixed timings, that the timetable is already set. So you can't change it. So you have to repair those milk teeth, because what happens is, we feel that mouth is such a small part, or there are so many teeth which are available. Yahan se nahi to wahan se khayega, you know. But then overall health of a child gets hampered, as well as the academic progress also. Such majority of such children, they don't attend school. If you try to intervene in that portion, you as you are a teacher, just take care of all this, because many a times they will not tell you that their teeth is hurting, they will tell you some other reason. But then maximum times, if they have some swelling, some pain in the teeth, they are not going to attend the school also, because dental pain is one of a very, very sharp shooting pain. It's very intolerable. And with children, it is quite tasking with them also. Now, coming to the brushing routine, till 5 years of age, I would suggest that parents should assess their children, because just giving them that brush and, yeah, he is doing on his own is not the way. You have to teach them first. Initially, you have to do with them, then you have to do their brush. You have to teach all of, yeah, which surfaces have to be covered. You have to observe whether he's covering all the surfaces or no. So assistance is required till the age of 5 years. And above 6 years, since they are quite, developed, and the hand dexterity is also developed, they can do it by themselves. Now, this was the home routine which we have to follow. Now, for children specifically, there is a very interesting or very nice caries preventive measure. You might be knowing about now. See, we all know that in all the market products, we have this fluorides. Fluorides is very important for your teeth. Fluorides has, this toothpaste has this much fluoride, and this product has that much fluoride.
Toothpaste
Even the
में
herbal
नमक ये
paste.
kind of ads.
Yes, yes, namak hai, haldi hai, everything.
Yeah.
Neem hai. There are so many marketing strategies going on. But on top of that, yeah, fluorides will take highest position in all that. Initially, in the developmental stages, when the teeth are developing, or when the baby is in the womb, or the teeth are developing, systemic fluoride, that is the fluoride through drinking water, is more important. Okay. And the community drinking water, it should have at least 1 parts per million of fluoride. So this is a very important concept. So community water fluoridation is a major, it plays a major role in it. But once the tooth are in your oral cavity, okay, now the role of systemic fluorides or the water fluorides, it reduces, and the topical fluoride or the local fluoride application, plays a major role. Since we all have these toothpaste, we use all these toothpaste with containing fluoride, but then still many a times what happens, there are multiple caries or multiple cavities in some children. So in such children, in such cases, we recommend a fluoride application. It is like a gel or a varnish, yeah. It is placed on all the teeth surfaces for 2 minutes, just for 2 to 3 minutes, and it is just applied once a year. What it will do is it makes a protective layer on the tooth surfaces. And if the patient is prone to caries, much or recurrent caries, then that progress will reduce. So topical fluoride application plays a major role. Now, what these fluorides do is, actually what they do is, first of all, they reduce the demineralization. Okay, the breakdown of that tooth surfaces, they reduce that. Second thing, they will promote the remineralization also. And third thing, they fight against all the bacteria also in the oral cavity. Last thing in the child section will be nursing bottle caries. Now, many a times we see that children are given those milk bottles. They are just given, and parents are doing their work, or sometimes while sleeping also, they are, put to bed with that bottle in the mouth. But after drinking, there is no routine followed. Like there is no, like I told you, with a washcloth, you have to just clean it, or, just rinse their mouth or gargle, whatever. It is not followed. And in such small children, it is little difficult also. But then this nursing bottle, what happens is, there is a residual milk which is, remains in the night, in their mouth. Whole night it is remaining. And since it is done gradually, like every day they follow the same routine, so what happens is, there are many white spot lesions on the tooth surfaces, which is start developing in such kind of children. And such white spot lesions, they gradually they get converted into brown cavities, and only 4 to 5 teeth in such children, they remain caries free. Otherwise, all the teeth are involved. And at the age of 3.5 to 4 years, now see, a small child has only 20 teeth, unlike we, which we have 32, but small children, they have 20 teeth. So if only 4 to 5 teeth are caries free, other 10 to 15, they are all carious. They all have those brown spot lesions or brown cavities. So this nursing bottle, it has to be stopped. Use of spoon and, our traditional methods is more, good for their oral health. So this was regarding the small children. Now I'll just talk little about the role of food. As we all know that we do have to avoid junk food and carbonated stuff, and chocolates also to some extent, since they contain large amount of harmful substances like sodium. They have high sodium content, high sugar content, carbohydrates also, and which in turn give rise to very harmful acids in our mouth also, as well as in the stomach also. So these foodstuffs are better to be avoided. Secondly, these foodstuffs are very sticky. They are very sticky. Since I told you, the food which stays back on the teeth does much of the harm than what goes inside the stomach. So these foods are very sticky. So even after eating, if you observe a child's mouth, even when he has chocolates, all the tooth surfaces, all the grooves which you see on the tooth surfaces will all be occupied with this sticky stuff. So all the sticky stuff has to be avoided to large extent. And healthy snacking should be promoted. Yeah, fruits and salads. Children rarely have all this now. They have that chips and biscuits and whatnot stuff.
And
So
somewhere
it
parents
is,
are like, if the child is insisting for that, okay, take it, keep quiet now. Let me do
yes,
my
yes, yes.
work. So
So that
nowadays,
they
and
are also
so
at
many
peace.
products are there. Even if we on our TV channel, YouTube and Facebook, everywhere such kind of things are promoting. Ye khaiye, such
Yes,
kind of chocolate, such kind of chips and all. So somewhere it is
yes.
going to be difficult for parents as well to how to deal with such things.
Yes, yes, yes. Even if you don't get those things at home, on
Right.
television, when once they watch their cartoon movies, there are so many advertisements coming up, advertising chips and biscuits and jellies and chocolates. Then it becomes really difficult. Even if you go for grocery shopping, you take them along, they demand you so many things. It becomes really difficult. So, but then we are helpless. All the markets, yeah, you just can't help it.
Right. So this is going to be a very tough task for the mamas as well कि आपको इस
Yes,
बार कुछ
yes,
तो
yes.
rather than tasty ना कुछ तो creative way में बनाना होगा कि वो tempting हो और बच्चे वो खाए. Because I have
Yes, yes,
seen
yes.
कि they don't care about कि कितना tasty है, वो कितना
Hmm.
creative, कितना अच्छा दिख रहा है, बस उस चीज में उन्हें वो ज्यादा इंटरेस्ट होता है कि बस ये चीज मुझे मिल जाए. That is okay for me.
Yes, yes, yes. Definitely, definitely. They want something new every time. They
Right.
want something new.
Right.
Yes.
और वो ही उनके कोई एनिमेटेड कैरेक्टर ने अगर कर दिया है प्रमोट कि यस मैं ये
Hmm.
खाता हूँ, सो देन फिर बस
Oh,
साल भर तक
yes.
बच्चे को वही खाना होता है. दैट इज ट्रू.
Khana hota. Yes, yes, definitely. There's so much they, believe in all those things because since they're very innocent, they hardly
Right,
understand anything,
right,
harmful things.
right. Okay.
Now I'll just talk about 3 or 4, most common dental problems. Okay. I will tell you the causes and simple treatments also. Okay. Number 1 is halitosis. Halitosis means your bad breath. Okay. Even if there is no other dental problem, everybody, maybe, they have the problem or no, but then they want to ask us like, what to do about this bad breath, because at some point of time, even if you follow all the routine, there are other factors, like if you sometimes your stomach is upset, sometimes you have some infection in your nose or your throat, there are so many bacteria or some infections or material, getting reproduced inside your mouth. Because of that, you might sometimes get this bad breath. Okay, so it's a unpleasant breath odor, which is called as bad breath. Another one factor which I told earlier also is coating over the tongue, which has very high concentrated bacteria inside it, and those bacteria are continuously producing very harmful gases and liquids, for those release that bad breath. Okay, and now the treatment will be, first of all, start with the tongue cleaning. If you're not, habitually doing it, start with the tongue cleaning. Second is you have to stay very hydrated. That is, you have to drink a lot of water, because water helps in, removing all the toxins. Manually also it will help, and otherwise also if there's some problem in the stomach, water will take care of. And third thing will be mouthwash. Now this mouthwash also, many people, they just see the advertisement and they just go and get it, and they use it on a regular basis. Now sometimes it is alcohol based, sometimes it is water based. If it is water based, it is okay if you use it sometimes, but the alcohol based ones, they are not to be used without any prescription. Yes, yes. So, and with mouthwash, I would like to tell you that it is, if it is prescribed only, then you have to use it, because it has all the benefits, like it has all the, it kills the bacteria, pathogens which are there in the oral cavity. It has many minerals, which, it rebuilds all the tissues in your mouth or the teeth in your mouth. And it also has a disinfecting property. Okay, the mouthwash, and the slight flavor which is there, which is given in the mouthwash, it also helps in removing bad breath. Okay, but then excessive use of such mouthwashes like the alcohol ones which I told you, sometimes what it does is it kills even the good bacteria of your oral cavity. So prolonged, and if it is not recommended to use, you should not use it on a regular basis. Only when it is prescribed or it is needed or occasionally you can use it for bad breath. Number one will be tongue cleaning, and second will be use of mouthwash for bad breath. Second most important, most common problem will be bleeding gums. Many people complain that, while brushing or once they get up early in the morning, there is blood seen in the mouth, or when they brush, there is bleeding from the gums. Okay, now see, if there is a problem like bleeding, there has to be some culprit. Gums, first of all, they are the supportive tissues which support your teeth, they hold your teeth in place, okay, along with the bone. But normally, now see, they are light pink or to dark pink in color. Your gums will be light, like for our Indian skin tone, they are light pink to dark pink in color. But then due to poor oral hygiene, like there is accumulation of plaque, calculus, and sometimes because of some medical problems also, there is change in this color and texture of the gums. Because of accumulation of plaque, calculus, or some other medical problems, sometimes in pregnancy also, there is this gingivitis or swelling in the gums. Okay, so in such cases, there is change in the color as well as texture of the gums. Okay, color will be darker, that it will go from dark pink to dark red. Okay, or even darker than that sometimes. And even the texture of the gums, such gums, they become very soft and rubbery. Even sometimes if we touch it, bleeding starts. They are so soft. Yeah, the texture, now this texture and all is because of infection which is going on in the gums. gums actually they rest on your teeth. But when that position is taken up with calculus, calculus is that hard deposit which accumulates along the gum line and sometimes on the tooth surfaces also. You might be knowing about that hard stony deposit sometimes gets developed from the inside surfaces of our teeth. That is called your calculus. Okay, so if this position, if the tooth is replaced with that calculus, and if the gums are resting on that calculus, they will start getting inflamed, friction will develop, they will go soft, rubbery, and then they will swell. That is, the swelling will develop. And once we start brushing, early morning, they'll be all full with that blood. Okay. And once we start brushing, they will rupture and you will see bleeding of the gums. Now, if this problem has also to be treated, as early as possible if it is severe. If it is mild, then maybe after some days, a proper oral hygiene maintaining, it may eventually go. But then if it is not going, then, you really have to consult a doctor. You have to get a scaling done. Now, scaling is just a manual, like your manual toothbrush. We have a toothbrush in our chair, which works on power. It's like a power toothbrush. And we have to just remove those calculus deposits and free those gums from all that calculus. And such kind of swellings also, they take some like 3 to 4 weeks to recede. So scaling will be the ultimate for your gums. If you see anything developing along the gum line or on the tooth surfaces, then immediately you have to get it clean, because with a manual toothbrush, how much ever pressure you apply, it is not going to, eradicate that. So you need to see a doctor for that. Third most common problem is sensitivity. Sensitivity, now usually what happens, it's a sharp pain. It is very short duration, but it is very sharp. And sometimes, if we have any cold stuff also, if normal teeth also, sometimes we get that sensitivity pain. And sometimes it is usually related to the climatic or the weather conditions. If you're staying in some cold weather, or if the climate has changed, it is cold, you will feel the sensitivity. So this is a very short reaction which is given by a tooth. It is not like a continuous pain. But then in certain people, it is very, it is very intolerable. So we have some certain treatments for such people also. But then generally what we do is, we recommend those toothpaste. Now, those toothpaste are also being advertised too much in the market nowadays. Sensodyne and all not, I don't know, Sensoform, Sensodyne and all, now what basically these toothpaste do, they have this strontium chloride. Okay. Now what it happen, first of all, this sensitivity, why does it happen, is when the enamel surface, the enamel layer of the tooth surface is eroded or it is worn off, due to aging or due to hard brushing, whatever, the dentine layer from inside, it gets exposed. And this dentine is porous in nature. Like, unlike your enamel, which is very tough and it's like a bone, or it is more stronger than bone, dentine is soft and it is very porous. It has small tubules inside it. So once the outside condition, like stimulus can be anything, like cold water, cold air, electric, chemical, sometimes if you have that tangy food, if you have tangy food, even that time you can get sensitivity. So what happens is, these tubules are exposed. When these tubules are exposed to such stimuli, that gives sharp shooting pain. Now why? Because these tubules have minute nerve endings. Each tooth has a nerve and a blood supply. So the nerve endings, the final parts of the nerves, they are in this dentinal tubules. And when such stimuli, get exposed to such porous dentine or the exposed dentine, then this hypersensitivity or sensitivity problem arises. Now, what this toothpaste have to do is, once we apply this, start applying this toothpaste, what happens is there's a chemical reaction and these tubules are blocked. They are kind of sealed, Now this procedure, it will take some months to go. Okay, it's not like overnight the problem will go off. So once you start using this toothpaste, what they will do is it will block the openings of these dentinal tubules, the exposed dentinal tubules, and slowly gradually the problem will come to an end. Okay, or at least it will reduce. Okay. And another system what we follow, or another products we have, we actually what they do is they desensitize the nerves. The toothpaste what we use at home are for blocking of the dentinal tubules, and the procedures what we use in our dental setting, they desensitize the nerves. They are kind of varnishes or resins which we apply on the exposed parts, which desensitize the nerve endings which are present in the dentinal tubules. So for sensitivity also we have quite, two types of treatment. One can be done at home, another one can be done in the dental setting. Last, I'll come to mouth ulcers. This is also very much common. If there is at least one person in the whole family, at once a month everybody will be like, yeah, I have got some ulcer. There is much talk about it, but then people usually actually they don't need to do anything. But then sometimes, what happens, it is very painful also. There are two types actually. One will be very subtle, it goes after 1 or 2 days, but then sometimes it needs treatment, as in there is no as such dental treatment which you have to do. First of all, I'll tell you about the causes, like how, how you will get encounter these ulcers. Sometimes they are caused due to local trauma. Now see, there are many people, like aged people, most of the time they have these broken teeth in their mouth. They hesitate to go and do the treatment, or they are afraid to go, or there's some reason. But then there are broken teeth in their mouth. Sometimes there are broken fillings in the mouth. Once the tongue or the cheek, they get rubbed against such sharp edges of the teeth, then mouth ulcers come out. Okay. Sometimes there is cheek biting, lip biting. Sometimes there are ill-fitting dentures or braces in the young people, in the students which we are using braces. Sometimes because of friction, even ulcers develop in their mouth. Now, and another reason will be infections or stress. Aphthous ulcers mostly happen due to stress. So in students who, on the they are going exam going students, like board students and all, 10th and 12th standard students, mostly they get this aphthous ulcers, because of the stress also. Huh? So now the treatment available is more of a local treatment and a vitamin treatment. That is, vitamin B12 is very much, effective in reducing all this recurrent ulcers. And there are certain gels in our fraternity which we prescribe, uh, that can take care of the local, irritations or pain which is, accompanied with such mouth ulcers. Finally, I would talk about this role of vitamin D, calcium, and fluorides. Now, many people, they ask us कि दूध पीना चाहिए क्या? दूध नहीं पीता है तो वो, दांत कैसे अच्छे आएंगे, या दूध पीने से ही दांत अच्छे आते हैं क्या, white आते हैं क्या? There are so many questions. So, regarding that, I would say that, see, calcium and vitamin D, they play a major role, but they play it only when the in the developmental stages, when the teeth are developing, they are in their very initial stage, or the structure is being formed in the mouth. Once the tooth is out, it is, beyond all these things. It is a hard structure. It is harder than bone. It does have its nerve supply, blood supply. It gets its calcium, to certain extent, and all the minerals. But then hardly will it make any difference even if you drink or eat calcium, or some people even ask us for calcium tablets कि दांत अच्छा आने के लिए उसको calcium tablet खिलाओ क्या, but it is not going to really help you. Taking care of the local, like the oral hygiene, maintaining the oral hygiene will help you, but not this vitamin D or calcium and fluorides. It is not going to help you once the teeth is outside. And you can also see if certain children, you see there is pitting, pitting like fluorosis, what you say. Sometimes the community supply, the concentration is too much. So you have to check it with that also. If it is, the concentration is not proper, then you have to get it done. So fluorides, yeah. So fluorides also have a major role, but everything will be only in the developmental stage, not beyond that.
Okay.
Yeah, so this was all from my side for today.
No, you have explained it very nicely. I think many of the parents and students has cleared their doubts. So I don't think so. No one has have any kind of questions right now. But the thing is, key prevention is better than cure. Rather than doing or caring after having some problems or difficulties in your teeth and oral hygiene, it would be better that you have to prevent such things.
Yes.
Right. So thank you so much, Dr. Shruti, joining with us. And really, we are glad that you have shared so valuable information with us, with our viewers. Thank you so much from Jadhavar Group of Institute, ma'am. Thank you so much.
Thank you, ma'am. Thank you so much.